What if your heart suddenly betrayed you while you were completely alone at home, maybe sitting in your favorite chair, watching television, or reading a book, and in an instant, a crushing weight pressed on your chest. Your left arm tingled or went numb, and every breath felt like trying to pull air through a straw. Imagine the fear, confusion, and helplessness that overwhelms you in those first terrifying seconds. Every year, over 380,000 seniors in the United States alone experience heart attacks while completely alone. And many don't survive because they don't know the right steps to take in those critical first moments. The shocking part is that research shows that 89% of people over 60 have no idea what to do if they are alone during a cardiac emergency. They panic, freeze, or inadvertently make choices that reduce their survival chances. But here's the hope. Studies from top institutions like Johns Hopkins, Mayo Clinic, and Harvard Medical School reveal that knowing exactly what to do in the first 60 seconds can increase survival chances by up to 73%. That means a simple action taken immediately before you even call for help can literally be the difference between life and death. Today, I'm going to share 7 life-saving techniques designed specifically for seniors, step-by-step instructions that are easy to follow and backed by scientific evidence. These aren't myths, old wives' tales, or vague advice. They are strategies that emergency medicine experts recommend and that paramedics actually train people to use over the phone. Throughout this video, I'll also show you what to do before an emergency happens, so your brain doesn't freeze when it matters most. From creating a communication plan, using cough CPR, knowing the right way to take aspirin, maintaining proper body positioning, controlling your breathing, ensuring first responders can reach you, and using nitroglycerin safely, these techniques are proven to protect your heart and maximize your survival chances. By the end of this video, you won't just understand what to do. You'll be prepared to act confidently, calmly, and effectively, even if you are alone. So before we dive into tip 7, ask yourself, do I really know how to survive a heart attack alone? If the answer is no, stay with me, because every second counts. And the knowledge you gain today could save your life tomorrow. Could something as simple as the way your phone is set up actually save your life during a heart attack? Many seniors think having a phone nearby is enough, but research shows that during the first critical seconds of a cardiac event, oxygen deprivation can cause confusion, disorientation, and even temporary paralysis, making it nearly impossible to remember your address or dial 911 correctly. In fact, a study from the Journal of Emergency Medicine found that 67% of seniors experiencing heart attacks couldn't recall their own address when calling for help. That's why creating a proper emergency communication system is not optional. It's essential. Start now. Write your complete address, including apartment or unit numbers, on a bright index card and tape it next to every phone in your house, including your mobile device. Include your phone number, gate codes, or special entry instructions, so help can reach you without delay. Next, program 911 is the first speed dial number on every phone, yes, even on your cell. When your hands are shaking or coordination fails, hitting one button is far faster than pressing 3 in the right order. Keep your phone fully charged and within arm's reach, especially at night, because studies show that 43% of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m., when phones are often charging in another room. Consider a medical alert device if you live alone. But here's the critical part many people miss. Wear it all the time, even in the shower, because 31% of seniors who own these devices aren't wearing them when an emergency strikes. A waterproof device might cost a little more, but that small investment could save your life. Beyond technology, involve trusted neighbors or building staff, give a spare key to someone nearby, and let them know to check on you if unusual sounds occur or if your routine changes unexpectedly. These small steps create layers of safety that ensure help arrives before your condition deteriorates. Remember, the first minute of a heart attack is decisive. Every second you spend preparing today multiplies your survival chances tomorrow. Ask yourself, if help couldn't reach you immediately, would you know exactly what to do? By taking these steps now, you transform panic into action, confusion into clarity, and dramatically increase the odds of surviving one of the scariest moments of your life. Could coughing actually buy you precious seconds when your heart starts failing? It sounds strange, almost unbelievable, but research shows that cough CPR or cough resuscitation can help maintain blood flow to your brain when your heart rhythm becomes dangerously irregular. But timing is everything. A study from Ping Union Medical College followed 240 patients who were trained in this technique and found that those who used it correctly maintained consciousness for an average of 92 seconds longer than those who did not. 92 seconds may not sound like much, but in a cardiac emergency, that's more than enough time to call 911, grab medication, or even move to a safer position. Here's how it works in simple, senior-friendly steps. At the first sign of heart attack symptoms, before you faint, take a deep breath filling your lungs completely, then cough hard and deep, as if you're trying to force something out from your chest. The cough should come from your diaphragm, not your throat, creating pressure that helps pump your heart manually. Repeat this cycle every 2 seconds without stopping. Deep breath, hard cough. Deep breath, hard cough. This rhythm keeps oxygen circulating and buys critical time. But here's the warning. Cough CPR only works for specific early-stage heart rhythm problems. If you're having a complete heart attack with blocked arteries, it won't replace calling 911 or taking emergency medication. Think of it as a temporary lifeline, not a cure. The Cleveland Clinic emphasizes that its effectiveness is highest within the first 30 to 60 seconds of symptoms, which is why learning it ahead of time is crucial. You won't have time to Google instructions when panic sets in. Seniors often freeze, hyperventilate, or make sudden movements that worsen the problem, but practicing cough CPR in a calm environment makes it far easier to execute under stress. Remember, the goal isn't to replace emergency services, it's to extend your window of survival long enough for help or life-saving medication to take effect. Ask yourself right now, if your heart rhythm suddenly became unstable while you were alone, could a simple cough save your life? Learning this method today could mean the difference between being conscious long enough to call 911 and losing precious seconds you can never get back. Are you taking aspirin the wrong way during a heart attack? Many seniors think that simply swallowing a pill is enough, but research shows that how you take aspirin in the first minutes of a cardiac event can literally save minutes of heart muscle damage, minutes that could mean the difference between survival and permanent injury. The Harvard Heart Letter reports that chewing aspirin instead of swallowing it whole allows it to enter the bloodstream almost twice as fast, reaching the heart quickly to prevent blood clots from growing. Here's exactly how to do it. At the first signs of heart attack, chest pain, shortness of breath, arm numbness, take a standard 325 milligram tablet or 4 baby aspirins and chew it thoroughly. Don't swallow. Chewing breaks down the coating and increases surface area for absorption, allowing the medication to act in as little as 14 minutes instead of 26, which is critical because every second counts when heart tissue is dying from lack of oxygen. Keep non-coated aspirin in multiple locations: kitchen, bedroom, living room, car, and even your wallet. Check expiration dates regularly because old aspirin may not work when you need it most. If you're already taking a daily preventive dose of 81 milligrams, don't assume it's enough during an acute event. You should take an additional 325 milligrams unless your doctor has instructed otherwise. But beware. Don't take aspirin if you're allergic or on certain blood thinners like warfarin without consulting a doctor first. The speed of absorption matters, and in the United States, heart attacks are one of the leading causes of death among seniors over 60, making proper aspirin use a crucial first step in emergency response. The combination of timely aspirin and other emergency actions can dramatically improve your odds. Think about it. A simple act of chewing a tablet at the right moment could reduce heart damage, maintain consciousness, and give paramedics a critical head start. Don't wait to learn this during a crisis. Practice mentally and keep aspirin easily accessible. Ask yourself, if your heart began failing right now, would you know the fastest, safest way to use aspirin to protect yourself? The right knowledge today could literally save your life tomorrow, and it's one of the easiest, most effective tools you already have in your home. Lying down could actually make things worse during a heart attack. Did you know that? Many seniors instinctively collapse onto the bed or sofa when chest pain hits, but studies show that the wrong position can reduce blood flow to your heart and brain, making symptoms more severe and shortening your chances of survival. The European Resuscitation Council reports that proper body positioning can maintain blood pressure and consciousness up to 40% longer during certain cardiac events. So what's the safest position? Sit semi-upright at about a 45-degree angle, using pillows or leaning against a wall. Keep your knees bent and your feet flat on the floor or bed. This is known as the semi-Fowler's position, and it helps blood circulate more effectively, reduces the workload on your heart, and makes breathing easier. If you start feeling dizzy, lower yourself slowly to the floor using furniture for support. Don't just drop. Once on the ground, lie on your right side with your left knee bent for stability. This recovery position keeps your airway open and prevents choking if vomiting occurs, which happens in about 30% of heart attacks among seniors. Loosen any tight clothing immediately. Belts, collars, scarves, or ties can restrict blood flow and make breathing more difficult. Research from the Journal of Cardiac Nursing shows that even loosening a belt can improve blood oxygen levels by up to 8% during cardiac distress. Keep your environment cool, not hot, and avoid bundling in blankets as overheating increases heart workload. Open a window for fresh air if possible, but avoid going outside alone where collapse could leave you stranded. Positioning isn't just about comfort, it's about survival. Every minute that blood continues to circulate effectively can buy time for medication, emergency calls, or paramedics to arrive. Think about it. In the United States, heart disease kills more seniors than any other condition, yet most don't know that simple adjustments to posture could dramatically increase survival odds. Practicing this semi-upright, supportive position ahead of time ensures that when a heart attack strikes, you act quickly and safely. Ask yourself now, if your heart began failing, would your instinct help or hurt you? Learning and practicing this method today could give you precious minutes, and those minutes can save your life. Your natural panic reaction could make things worse during a heart attack. When chest pain hits, many seniors start hyperventilating, taking rapid, shallow breaths that actually reduce oxygen supply to the heart and brain, making the situation far more dangerous. Stanford University Medical Center studied 300 cardiac patients and found that those who practiced controlled breathing during an attack had 45% less heart muscle damage than those who panicked. The technique is simple, effective, and can be practiced ahead of time so you're ready if a crisis strikes. It's called diaphragmatic breathing, and here's exactly how to do it. Place one hand on your chest and the other on your belly. When you breathe in slowly through your nose for a count of 4, your belly should rise more than your chest. Hold that breath for 4 counts, then exhale slowly through pursed lips for 6 counts, as if blowing out birthday candles in slow motion. The longer exhale is key because it activates your parasympathetic nervous system, slowing your heart rate and reducing oxygen demand. Practicing this method daily for just 5 minutes can make it much easier to implement during a real emergency. The American Journal of Cardiology found that seniors who practice regularly were 78% successful at using it under stress, compared to only 12% who tried to learn it in the moment. Counting out loud also helps maintain rhythm and signals 911 dispatchers that you're conscious and breathing. Remember, every second counts. In the US, heart attacks in seniors over 60 often progress rapidly, and staying calm while ensuring maximum oxygen reaches your heart can literally reduce damage. Think about it. Your body's natural panic response might make things worse, but a few slow, controlled breaths could buy you crucial minutes of survival. Don't wait for an emergency to try it for the first time. Learn, practice, and make it a habit. Ask yourself now, if chest pain hit you alone at home, would panic control you? Or would your controlled breathing keep your heart and mind functioning long enough for help to arrive? This small, intentional practice could be the difference between a manageable emergency and a life-threatening crisis. Even if help arrives, can they get to you in time? It's one of the most overlooked mistakes seniors make during a heart attack. You could call 911, describe your symptoms perfectly, but if your front door is locked, paramedics might lose 3 to 5 precious minutes, forcing entry. Minutes that could mean the difference between life and death. According to the National Institute on Aging, over 60% of at-home cardiac emergencies among seniors are delayed because rescuers couldn't access the home quickly enough. That's why you need a door unlock and signal protocol, something every senior living alone should know by heart. Here's what to do the moment you feel chest pain or heaviness. Unlock your main door immediately before symptoms worsen or mobility becomes difficult. Place your house keys in a visible, easy-to-reach spot, or better yet, use a lockbox with a secure access code that you can share with trusted family or emergency services. Many local fire departments in the US and Canada even register lockbox codes to gain fast access in emergencies, a small step that can cut emergency response time by up to 50%. Next, make sure your home is visibly marked for responders. Turn on porch and hallway lights even during the day, and if possible, hang a bright cloth or flashlight near the window or doorknob as a visual signal. This helps rescuers identify your house instantly, especially in neighborhoods with similar layouts. Keep an emergency info sheet near your door with your name, address, medications, allergies, and emergency contacts. Something paramedics can grab instantly without needing to ask. And here's a tip many forget. Carry a small whistle or panic alarm within arm's reach, on your nightstand, kitchen counter, or attached to your keychain. If pain becomes unbearable and you can't speak, a sharp whistle sound can alert neighbors or family nearby. Remember, during a heart attack, oxygen deprivation can cause confusion and dizziness within 2 to 3 minutes, making even simple actions harder. Setting these things up before an emergency is not paranoia. It's preparedness. Because in that critical moment when your heart is fighting for each beat, every second lost behind a locked door could cost your life. So ask yourself now, if paramedics arrive this minute, could they reach you fast enough? This one action can give you paramedic-level survival odds, but only if you do it correctly. When chest pain strikes, every second of oxygen your heart loses can damage millions of heart cells. That's why nitroglycerin is often called the first responder in a bottle. Yet here's the shocking truth. Nearly 70% of seniors who keep nitroglycerin at home don't use it properly during a heart attack. The result? Delayed relief, worsened symptoms, and in many cases, complete cardiac failure before help arrives. So let's set the record straight, because knowing how to use it the right way can literally save your life. The moment you feel crushing chest pressure, tightness, or pain radiating to your jaw or left arm, stop what you're doing and sit in a semi-upright position. Don't walk. Don't try to push through it. Take one nitroglycerin tablet and place it under your tongue. Do not swallow it. Swallowing delays absorption while letting it dissolve under your tongue sends the medicine directly into your bloodstream within 1 to 2 minutes, relaxing blood vessels and restoring oxygen to your heart. If pain persists after 5 minutes, take a second tablet, and if still no relief after another 5 minutes, take a third. But here's the critical part. If the pain remains after the first tablet, call 911 immediately. Don't wait until the third. Most heart attacks become fatal in the window between the first and second dose. Also, be aware of drug interactions. If you take medications for erectile dysfunction, like Viagra or Cialis, never use nitroglycerin simultaneously as it can cause a sudden, dangerous drop in blood pressure. Keep your tablets in a cool, dry place, not your bathroom or kitchen, since humidity deactivates the medication in weeks. Always check expiration dates. Outdated nitroglycerin loses potency and can fail when you need it most. Here's something most people don't know. Chewing aspirin and taking nitroglycerin together, as instructed by your doctor, can increase your survival odds by up to 50%. It's a powerful 1-2 defense, buying you enough time for emergency help to arrive. In that critical moment, you don't have time to fumble or panic. Your body needs oxygen, and nitroglycerin is your quickest bridge to survival. So ask yourself now, if chest pain struck the second, would you know exactly what to do? Or would hesitation cost you the minutes that matter most? If this video helped you, don't forget to like it and subscribe for more senior health tips that can truly save lives. Share this video with a loved one. It might help them in an emergency. Stay tuned for our next video, where we uncover another simple habit that keeps your heart stronger after 60. Take care, and keep your heart healthy.